All right, so we'll go ahead and get started. I'm Eddie. I'm one of the PGY4s, the chief resident for UC Irvine. A little bit about our program. These are the residents. We have 5 residents per class. From the left to the right, it's PGY2, PGY3, PGY4. We have 15 total. All 5 positions are advanced. And prelim medicine year, I did a prelim year myself, is available at UCI. And sometimes there can be a little bit of coordination to kind of help that as well. Here are our beloved faculty. There's Dr. Han, who's the chair right here. And then we have Dr. Ye, who's our program director. And then Dr. Chavez, who's our assistant program director. And then these are the rest of our clinical faculty as well. And here are faculty at Long Beach Memorial. We have Dr. Ko, who is our medical director. Long Beach Memorial is more of a private hospital, so it's run a little bit differently. And then these are our other 2 faculty members as well. Dr. Bedell primarily helps with the pediatric rehab rotation. And we have a lot of faculty members at the VA. The VA is one of our 3 sites that we rotate at. We have Dr. Nance, Dr. Chen, Dr. Han, who are responsible for the SCI education there as well. There's a SCI fellowship there. Dr. Tran, who's very involved with our EMG learning as well. And then we have our other attendings here as well. Here are some of our research faculty. If we were to get involved with any longer term projects, these are the individuals we would get in contact with. Here's a map of our different rotation sites. It's all hearted here. So over here near Orange is our main medical center. And then we also have our Long Beach Memorial, which is our furthest location up north, and our VA, which is right here. And then our new rehab hospital is actually opening up. It's closer down in Irvine. And then there's also another acute hospital that is opening up in Irvine as well, a new hospital that opens in December, I believe, this year. So for our academic curriculum, we have 5, 10 to 11 week rotations per year. In total, we have 69 weeks outpatient, which includes 20 weeks of dedicated EMGs and 6 weeks of dedicated pain management. And then followed by, we have 63 weeks of inpatient, 10 weeks of pediatrics, which is a little bit of a hybrid between inpatient and outpatient, 10 weeks of consults, and 4 weeks of electives. As our various rotation sites include the UCI Medical Center, the VA, Long Beach Memorial, which is a private hospital, and then we also have a outpatient clinic as well at the new facility, at the WEN facility, which opened in May 2024. It's a really, really nice facility where a lot of our pain 6 weeks are dedicated, are there as well. And then for the inpatient rehab facility, it's opening in 2026 and it'll be in Irvine, Maine. And a little bit about our hospital, our new rehab hospital. It's going to be a 52-bed standalone inpatient service. It's set to open in mid-2026. This is kind of what it's going to look like. And there's also a new UC Irvine Hospital campus, and that's a 144-bed inpatient hospital. It's a little bit different than the one in Orange, but this new hospital is going to be oncology-focused, neurology, neurosurgery, orthopedics, and digestive health. It's a really nice facility. And UCI Health is growing, so it's acquired 4 tenant hospitals around the area as well. All right, so a little bit about our academic curriculum. As it stands right now, during PGY 2 year, you do 2 blocks of inpatient rehab at UCI. And then it'll be followed by Long Beach Memorial, where you do another inpatient service there. And then our next, a couple of other rotations, the 10 to 11 weekers are at the VA. We have an MSK outpatient block and then a spinal cord injury outpatient with gait lab. And right here is what the Long Beach Memorial looks like as well. In our PGY 3 year, that's where we rotate. We do our more specialty focused. So we do pediatric inpatient, in addition to some consults as well. And then that's where we do the pain management 6 weeks. That one is mandatory, with followed by like 4 weeks of elective, whichever we could choose. UCI recently just had a partnership for a fellowship program for rabies down in San Diego as well for pediatric rehab. So they will be opening up some slots for electives, and I can only imagine that our pediatric rehab will grow as well. And then PGY3 is when we start our EMGs and also do some inpatient rehab at UCI. I'll kind of skip over this. I mean, UCI basically, UCI PM&R developed this badges project. It's recommended by AAP for introduction to research by PM&R, as well as like a self-directed curriculum. And it's something that all of us residents utilize. And last but not least, when you're a PGY4, you do the inpatient rehab consult. You see an outpatient as well, with Long Beach Memorial inpatient, more TBI stroke focused, and then do some EMGs. And in addition, we do have an outpatient block. This is what their VA looks like, where we do pain, MSK, PNO, and probability as well. So long story short, our academic curriculum is pretty spread out. I know some other programs are very inpatient focused in the first, PGY2, PGY3 year, but for our program, it's pretty spread out evenly throughout all years. All right. In terms of our outpatient rotations, we have these are the different types that we have: general, PM&R, neuro rehab, orthopedic surgery, EMG, MSK radiology, spasticity, Botox, amputee, a lot of varieties. A little bit about our call schedule. So this is what's anticipated for the new rehab hospital, but please do keep in mind that we have a committee going where there's like a PGY2, PGY3, and a PGY4 all kind of working together to see what would be the best call schedule for the residents. So this is only tentative. But it will be PGY2s will do a Q5 week. It's all home call. It's from 7:30 p.m. to 7 a.m. And then Q5 weekend call as well. PGY3s will not have a weekday call, but they will have a Q5 weekend call where they're covering half of the 52-bed unit, in addition to doing some possible weekend consults. And then as a PGY4, you will be doing a Q5 week home call, so 10 weeks at the private hospital in Long Beach Memorial. So weekend rounds on 8 area patients and occasional consults. So that's the tentative call schedule. It is increasing from our current area, which is only like 14 beds. So as we increase to 52, the call schedule and frequency will increase. Didactics wise, we do it once weekly, Thursdays 1 to 5. It's a 12-month schedule. We do a variety like VR, and we do a pool day as well. And this is Dr. Tran teaching us about EMGs. Procedure wise, wide array of procedures. We do it at the VA at all sites as well. Ultrasound gun injections, EMGs. These are just a list of all the different types of procedures we do as well. This is what our salary looks like right now. The contract is being renegotiated at this moment across all UCs. So I anticipate that this will increase within the next year. In terms of benefits of the program, time off, we get 30 days maximum per year per ABPM&R. So it's 20 vacation days on top of 10 sick days as well. We get a 1,500 education fund, and at UCI we do get 120 meal allowance per month. That's usually pretty good enough to get like a meal and a drink as well. And then we get our licensing fees reimbursed. There's free parking at all other sites other than UCI, which you do have to pay out of pocket for. These are just a couple of images of residents at some conferences. Our graduates go pretty much everywhere. We've had some sports, some go into spinal cord injury, a lot go into pain as well. And then some general inpatient, general rehab as well. This was our most recent pain match. And then popular cities, I mean, we're really in Southern California, so we have easy access to all kinds of beaches, Huntington Beach, Long Beach, even San Diego is only like an hour and a half away. Disneyland is right around the corner as well. And Universal only like an hour away, up north in LA. These are just a couple of images. I believe the right is Catalina Island as well. We have access to a bunch of sports. I've gone to a Chargers game myself, a couple Laker games here and there. Uh, and these are just some images for our resident life. We recently did a bowling social. This is a picture from our retreat. And then we recently played basketball. We try to play basketball together as a program every couple of months. These are attendees who took us out to lunch as well after a hard block. A couple more images, more from our Big Bear retreat or Christmas holiday party, and then our welcome event as well. That pretty much covers everything about our program. Just a very, very brief overview. I'll open it up to any like quick questions.
I do see a question in the chat. Are there opportunities to work with local communities or sports teams?
Um, UCI has their own family medicine it's family medicine driven sports medicine program, but they welcome us to join in any sports events as well. And sometimes in the past, residents have done some collaborations with the UCLA program to go to sports events. If you have accepted research at conferences, does that come out of the education fund? So it really depends on how you want to do it, but you can use that education fund to go to conferences, for flights, for hotels, such. Yeah, so we have a lot of residents who have families as well. Um, I mean, we're very, very supportive. A lot of our faculty are recently, part of the reason Dr. Chavez isn't here with us is because she's expecting and she's going to be delivering very soon. So, anytime that children need events and such and need to go to their scheduled health appointments, residents cover each other and we can use our sick days actually for that. And we also get additional parental leave under the UC contract as well. I believe it's up to 1 month. Uh, all right. Then does your program, let's see, the good sub-intern resident, sub-intern resident. What does a good resident look like for our program? I mean, anyone who's really just open-minded, eager to learn, very flexible. I think some of the biggest highlights for our program, I think the residents really do make the program. We're all love to hang out outside. We all support each other. Uh, and I mean, it's just keeping a good mindset coming into any rotation. Just eager to learn is pretty much all we ask for, you know. And then does your program consider IMG applicants? That I am not 100% sure, but in our recent years, we haven't had IMG applicants match with our program.
Right. Are there any more questions for Dr. Chang? All right, great. If not, thank you so much for that amazing presentation.